Good morning, everyone. I am Dr. Murali Chand from India. Today, I am going to discuss about proponents and opponents argument of role of surgery in tympanosclerosis. The proponents for the surgery, what they say is, if there is stapes atosclerosis there, it has to be done in a two-stage setting. And first stage, clear only the tympanosclerosis over the foot plate and close the perforation. And in the second stage, if the incus is intact and the stapes is mobile, you can keep cartilage from the incus to the stapes foot plate. Suppose if the stapes foot plate is not mobile, then you can do stapedotomy and you can keep the piston. Suppose if the incus is not there, then you can do malleus stapedotomy. And while clearing the tympanosclerosis or obliterative atosclerosis, the proponents of surgery say that we have to clear the whole foot plate and then only we have to do discrete fenestra into the stapes foot plate. This is the proponents of surgery in tympanosclerosis. Now, coming to the opponents of tympanosclerosis, I mean the role of surgery in tympanosclerosis, what the opponent's argument is, don't touch the stapes foot plate. Yes, you can clear a little bit with the right angle pick, but don't use the burr while clearing the stapes foot plate, and never do stapedotomy even in second stage also. The main reason is opponents are so much worried that it may lead to sensorineural loss and may cause tinnitus, permanent tinnitus. Some senior surgeon even saying that while clearing the stapes foot plate also, I mean in clearing the tympanosclerosis all over the foot plate and even in obliterative atosclerosis also, when we are clearing the total tympanosclerosis over the foot plate and the obliterative atosclerosis, even that may lead to sensorineural loss. So there is a lot of disagreement between proponents and opponents in role of stapedotomy in tympanosclerosis. And the opponent's argument is, instead of doing stapedotomy, clear the disease in the first stage, close the perforation, don't do the stapedotomy. If the stapes suprastructure is absent, keep the cartilage from the incus over the intact stapes foot plate. Even if it is fixed, just keep a cartilage from the incus to the stapes foot plate if the incus is present. If the incus is absent, keep the cartilage from malleus to stapes foot plate. Even in stapes fixed also, close the perforation in the first stage and just give the hearing aid. That is what the opponents are saying. This has to be discussed very thoroughly by the senior surgeons in our ENT conferences and workshops, and we must come to a logical consensus document. This will helpful to the juniors as a guiding. as a guide. It becomes a vision to the future surgeons, whether to act too radically or too conservatively. I think this will help for future surgeons. Please give your feedbacks. Thank you.